Now to the latest on COVID and the continuing fight worldwide there. The U.S. is restarting a program to send free COVID tests to households after a jump in new cases here. But there is a much larger COVID spread going on right now in China. In fact, it's keeping a lot of people at home, even though the government has loosened its COVID restrictions. Elizabeth Palmer has more.
Good morning. China is now facing its biggest public health challenge since the start of the pandemic.
COVID is spreading like wildfire in China, 9 days after the government abruptly stopped mass testing and forcible quarantine. Measures the WHO said had stopped working anyway.
The explosion of cases in China is not due to the lifting of COVID restrictions. The explosion of cases in China had started long before any easing of the zero COVID policy.
If so, no one had told the Chinese public. At clinics like this one in Beijing, people feeling under the weather wait and worry. For 3 years, they've been told that COVID-19 was a killer. Now the official line is, unless you're really sick, just stay home. It's quite a U-turn, reinforced by upbeat state messaging urging people to get back to normal. But Beijingers aren't buying it. Empty streets and businesses show they're opting for extreme caution. I have to be more careful now, says Liu, because no one else is going to protect me. On a visit to Beijing's main hospital, China's COVID czar Sun Chanlan said the priority is treatment, as the government admitted it had stopped counting cases and would focus on vaccinations. The protests that erupted across China at the end of November probably nudged the state away from its zero COVID controls, along with bad economic data. But a looming tsunami of infection may have been the clincher.
And this is just the beginning. A new study partly funded by China's Center for Disease Control warns that the country has to urgently roll out vaccines and antiviral medication if it's to avoid 1 million COVID deaths. For CBS Mornings, I'm Elizabeth Palmer in Tokyo. Still dealing with COVID 3 years later. Here we go.